And with us now for more on the president's announcement, what could be ahead for the United States, as well as how you can protect yourself from the coronavirus, is our CBN News medical reporter, Lori Johnson. So why are these 150 million tests important?
Well, in short, Ephraim, they're going to save lives. We know that we're talking about 150 of these rapid tests, so we get the results in 15 minutes. 100 million of them, 2/3 of those, are going straight to the schools. We know that kids are back at school. We know that kids have almost 0% chance of dying from COVID-19 and a very, very, very low percentage of hospitalizations. But we do know that kids get it and spread it. And so we think about children who take it home to their grandparents. So what's going to happen is these kids are going to be tested at school, and kids who test positive can therefore be isolated and keep it from spreading to other school children and especially their older relatives at home. And then the other 50 million, as you said, are going to be transmitted to other high-risk areas, historically black colleges and universities. We know that minorities disproportionately get COVID-19 and die from it in higher numbers. And then, of course, nursing homes. We've talked so much about nursing homes. Nursing homes are going to be getting a lot of these tests. We know that 8% of COVID cases occur in nursing homes, but 40% of deaths. And so this is going to be very important to identify these cases and then isolate them to keep it from spreading.
Absolutely. We're seeing a spike in some cases in Midwestern states and parts of New York City. Could we see a second wave of the virus in this country come the fall?
Absolutely. There's a very large concern about that. Now, we're seeing a huge explosion in cases in some states, in 7 states in particular. We're talking about North Dakota, South Dakota, Wisconsin, Minnesota, Utah, Wyoming, and Montana. But these are the first time around. We're seeing a large increase in cases. This is not a second wave. This is the first time. But we're talking about test positivity rates of 25%. That's huge. Anything over 5% is concerning. Test positivity means of all the people who are tested, what percentage test positive? And we're talking about 25% in these 7 states. Very concerning because it indicates that there is a large circulation of the virus in the general public. The good news is we haven't seen much of an uptick in deaths, really hardly at all in those states, but we are seeing more hospitalizations. And you know that deaths are a lagging indicator. We may see these later. Now, in New York, we are seeing a second wave. In the state of New York, 1.5% test positivity, and in New York City, 2% test positivity. That seems very low, but it's double what it has been in recent months. And we're talking about 10 zip codes in the entire state of New York that make up 25% of the cases. And experts say the reason that we're seeing this uptake, people aren't doing the mitigation efforts. They're not wearing the masks. They're not social distancing.
Yeah, not time to let your guard down at all. Yeah. A new study out of Houston found that there is one strain of the virus that's mutating. What's the story on that?
Well, we always see viruses mutate. This is what viruses do. And we're seeing in Houston, 99.9% of the cases were this mutated form of the virus. The good news is that it's less lethal, but it is more contagious. And so this is what we see with the common cold. Very contagious, not that lethal. The big concern about a virus anytime it mutates is that we hope it doesn't mutate so much that it doesn't match the vaccine. Right now, health officials are not concerned.
Okay. What about ways to protect yourself from the virus? We understand getting enough vitamin D can be helpful.
Vitamin D is so important. We know that studies show that people who get COVID are 50% less likely to have serious complications if they have adequate numbers of vitamin D, adequate levels of vitamin D. We know that vitamin D comes from the sun, but nobody goes outside anymore. And if you wear sunscreen, you're not getting the vitamin D. So doctors do recommend supplementation. Most Americans are severely deficient in vitamin D. Vitamin D also helps protect against a lot of other things. I just did an interview with a doctor who talked about food allergies, and if you get adequate levels of vitamin D, you're much less likely to have food allergies, and the list goes on and on. Aside from vitamin D, there are so many other things that we can do to prevent having complications from COVID-19 if we are infected with it. One of them, of course, is having a healthy gut microbiome. And I talked to a gut microbiome expert on this week's edition of Healthy Living.
All right. Thank you so much, Lori Johnson. And speaking of Healthy Living, you can catch that this evening at 9:30 Eastern. And, of course, you can find that on the CBN News Channel.